Alright guys, it's Dr. Muhammad. This is Unit 3, Delivering Care, and today we are going to wrap up. We are going to be talking about healthcare payments. This information, we're getting a little bit into the weeds. I know this is the thing that most people don't want to hear about, but it is still very testable, so we're going to go through it. There's going to be a lot of examples and make sure that you guys can get these questions right on test day. Alright, so like I said, we're going to be talking about payment models, and there's a couple different payment models that we need to know about. The first one is going to be a bundled payment, and a bundled payment is when a healthcare organization receives a fixed amount that is divided amongst all providers and facilities. The important thing to know about this is that that amount is fixed regardless of the total cost. So the amount that is going to be divided up amongst everyone is fixed regardless of the total cost. We're going to come back to an example for that in a minute, but the next one that I want to move on to is going to be called capitation. Capitation is that a physician receives a fixed amount per patient per unit time in advance. This is something that is predetermined. The amount is fixed regardless of how much the patient uses their healthcare, and this is primarily used by pure HMOs. So in the last section we talked about different health insurance plans. This is the one, capitation, that is used by pure HMOs. So here we have an example for capitation, and these numbers are completely made up. I'm just going to use small, easy to digest numbers. So say a physician has a practice, they have a clinic, and they're using capitation. They determine that for all patients who are 0 to 1 years old, they are going to charge $1 per patient per month. So all of the patients who come through that are 0 to 1 years old, it's going to be $1 per that patient per month. And then they have patients who are 1 to 2 years old, they are going to charge $2 per patient per month. So capitation, it's a fixed amount per patient per unit time that is paid in advance, and it is frequently broken up into age like that. Remember, this amount is fixed regardless of how much the patient uses their healthcare. So for example, going with that second example here, if we have a 2-year-old patient that uses 1 month healthcare, it's going to be $2. If they use 100, it's going to be $200. The rate doesn't go up just because the amount of use has gone up. It is going to be fixed regardless of how much the patient uses their healthcare. And remember, again, capitation is primarily for pure HMOs. The next payment model we're going to talk about is fee-for-service. And fee-for-service is basically the insurer and or the patient pays for each individual service. And we're going to get to an example about this in just a moment, but let's go through it. Fee-for-service, the insurer and or the patient pays for each individual service. The nice thing about this is that it allows the patient more flexibility to see the providers that they want to see. Hopefully that sounds familiar, and I'll tell you why in a second. The other thing to know about this, and this is going to be a recurring theme for some of the other payment models we're going to see, the health plan may pay the provider directly, or they may reimburse the patient for pay. This payment model is frequently used by PPOs. If you remember from the last section when we were talking about healthcare plans, something like a PPO where you have the flexibility to go and see the PCPs, the specialists that you want to see, there's a lot of flexibility with that. And fee for service is also a lot of flexibility, right? You can see the providers that you want to see, and you can pay each of those providers for their individual services. We're going to go through some examples real quick, and I apologize in advance. I am not an artist, but I'm just going to keep things nice and simple just to make sure that you guys really understand it. Let's say, for example, you're the patient and you have to get your appendix out. You have to get an appendectomy. And this is you right here. You are the sad face because you have to get an appendectomy and you're not feeling well. With a bundled payment, remember we said the healthcare organization receives a fixed amount that is divided amongst all the providers and facilities. So you, the patient, are paying a fixed amount, as you can see right here, that is going to go to all of the providers and all of the facilities. That fixed amount is going to go to the hospital. It's going to go to the surgeon. It's going to go to the anesthesiologist. That is a fixed amount that is paid, and it's divided amongst all of those providers and facilities. That is a bundled payment. In contrast to that, a fee for service, remember the insurer and or the patient is paying for each individual service. You, the sad patient, are now paying individually. You're paying the hospital individually. You're paying the surgeon individually. You're paying the anesthesiologist individually. That is the important difference to know between bundled payment and fee for service. The next payment model we're going to talk about here is discounted fee for service. And what discounted fee for service is that the insurer and or the patient pays for each individual service at a predetermined discounted rate. So it is similar to fee for service, but it is discounted. Thus the name discounted fee for service. You're paying for each individual service at a predetermined and discounted rate. And same thing, just as with a fee for service, the health plan may pay the provider directly, or they may reimburse the patient for paying. This is also frequently used by PPOs. Remember, PPOs, a lot of flexibility with the providers and the specialists that they get to see, so you want a plan like this that'll allow for flexibility. Quick review with that, capitation, remember, is going to be used by HMOs, by the Health Maintenance Organization. fee-for-service and discounted fee-for-service is going to be used by PPOs, the Preferred Provider Organization. Really important to know which of those payment models goes with which of those healthcare plans. The next payment model that we're going to talk about is per diem reimbursement. And per diem reimbursement is basically the insurer will pay for services based on the number of days that the patient receives care. What does that mean? Let's go through an example of that. So this is you again, right here. And let's say you broke your leg, unfortunately. I'm sorry. Your leg's broken. And you go to the hospital to get that taken care of. Now, the hospital knows from previous data that the cost for management of a broken leg is about $1,000, and that patients frequently stay in the hospital for a broken leg for about 5 days. So 1,000 divided by 5, the hospital knows that it's probably going to be about $200 per day. So that's what's going to be charged. So per diem reimbursement, the insurer pays for services based on the number of days the patient receives care. So if you stay in the hospital for all 5 days for that broken leg, it's $1,000. If you stay for 4 days, remember it's $200 per day. So for 4 days, it's $800. So it's per the number of days that the patient receives care. That is per diem reimbursement. The next example of a payment model, and it's not very common, but it's pay for performance. And this one's actually going to be high yield because there's a lot of interesting caveats here. Pay for performance, basically what this is a payment model that offers financial incentives for meeting certain performance measures. It's very important to know this. Pay for performance, you are getting paid for that level of care that you provide. Some examples of some of these performance measures, and this can vary as well, are things like lowering blood pressure, smoking cessation counselation. Remember, previously we talked about disease prevention and management. One of the things that's becoming more and more important is disease prevention. So doing these things that are preventative measures like lowering blood pressure so that a patient doesn't get hypertension, or smoking cessation so that a patient doesn't get lung disease or COPD or what have you, those kinds of things with this model would get reimbursed. And that sounds like a really great thing, right? The incentives can be as high as 25% of a provider's income. So there is a lot of incentive to be had there. The caveat with that is that you would also get penalized for poor outcomes and for medical errors. So if you do good things, if you do preventative medicine, you are going to get incentives. If you do bad things, if you are harming your patient, if you are committing medical errors, you are going to get penalized for that. The overall goal of pay for performance is to improve efficiency, quality, and value of healthcare. We want to be taking care of our patients. We want to be providing a high quality of care. So something like pay for performance will promote that. And overall, this sounds like a really good plan, right? It allows providers to get incentives. Providers will work harder to provide higher quality care to their patients. So why isn't it that common? First of all, the fact that providers can get penalized if they have poor outcomes or medical errors. That's one of the things. And unfortunately, some of those things can't be prevented. So a provider may have a poor outcome that they couldn't prevent and they would get penalized for it. That's one of the issues that providers have with the pay for performance. The other issue is that physicians disagree with some of these performance measures. And in certain areas, they think that they are difficult to achieve or they're unreasonable. There are a lot of different performance measures out there. I know I gave lowering blood pressure and smoking cessation in this example, but there are a lot of more specific ones that a lot of physicians feel are unreasonable for them to be trying to achieve. The other big issue with the pay for performance model is that these measures are frequently not adjusted for different areas and different factors such as socioeconomic status. So a physician taking care of really sick patients in an area, they're not going to meet these performance measures and they would get penalized because of that. It's not because the provider is a terrible doctor. It's just because of the fact that their patients are so sick, they're not going to be able to lower blood pressure. They're not going to be able to lower their A1C or those other performance measures. And because of that, the doctor wouldn't want to be involved in a pay for performance plan. So really important to know all the caveats about that, why it's such a good thing, what the purpose is, but why providers typically don't like to use it. The final payment model that we're going to talk about is going to be global payment. And global payment is basically the insurer and or the patient pays for all of the expenses of a single encounter with a single payment. Just as we saw before, the health plan may pay the provider directly, or they may reimburse the patient for paying. And this is usually paid monthly per patient over 1 year. So this payment can get reimbursed once a month for a total of 1 year. This is something that's frequently used in elective surgeries. And an example we're going to give here, it's going to be really simple. Say, for example, again, you're getting your appendix out. It's going to be an appendectomy, and completely made up number, but you're going to pay $10 with a global payment. You have a global payment model. You are paying $10, which is a steal, for this appendectomy. The cool thing about global payment is that that money that you pay, that single encounter with that single payment, that's going to cover everything that has to do with that procedure. So all of the pre-operative visits, the surgery itself, the post-operative visits, all that is going to be covered under that one lump sum that you paid up front. And if you're the patient and you paid it, you will be reimbursed once a month for a total of a year. Really, global payment The purpose of that is going to be to kind of cover all of the expenses all at once. Quick recap, this is Unit 3, Delivering Care, and we are talking about healthcare payments. There are a lot of different payment models that we had to go through today. Remember, bundled payment is a fixed amount that is divided amongst all of the providers and facilities. Capitation is a fixed amount per patient per unit time that is paid in advance, frequently used by pure HMOs. Fee for service, the insurer and or the patient is paying for each individual service, and this is frequently used by PPOs. Discounted fee for service is the same thing, but is a discounted predetermined rate for each individual service, also frequently used by PPOs. Remember, it is allowing for that flexibility that is offered with a PPO. Per diem reimbursement, the insurer is paying for services based on the number of days that a patient receives care. Pay for performance, remember this one was high yield. There's financial incentives. If you meet these incentives, providers can get reimbursed for that. If they are having negative outcomes or making medical errors, they will get penalized for that. But the overall goal of pay for performance is to improve efficiency, quality, and value of healthcare. And then finally, global payment, the insurer and or the patient will pay for all of the expenses of a single encounter with a single payment. Really useful, especially for things like elective surgeries. All right, that's it, and I'll see you in the next one.